Hello everyone, welcome to my channel medtime.com. I am Prajwal. In this video, we'll study the drugs used in management of peptic ulcer or the drugs which are categorized under anti-ulcer drugs. Before going to this, let's recapitulate what is peptic ulcer, what is the pathogenesis of peptic ulcer. Okay, stomach. It is a C-shaped structure. We can see different parts of stomach here. So stomach starts from the sphincter called as cardiac and ends with the pyloric sphincter. In between these sphincters, there are different parts like fundus, body, antrum. Okay. The stomach which starts at the end of esophagus and it is ends with the start of duodenum, proximal duodenum. Okay. And when we take the cross section of this stomach tissue, we see some tissue layers. So the layers are serosa. Serosa is followed by muscularis and then submucosa and the innermost mucous membrane or mucosa. Okay. So this mucous membrane, it is the insoluble gel layer that will prevent the wall of the stomach, from the corrosive effect of acid and proteolytic effect of pepsin. Okay. Corrosive effect of acid and from pepsin. It will prevent the wall of the stomachs and all these layers from the pepsin and the acid. Okay. So at the innermost part, there is presence of lumen. Okay. Inside the lumen, there is presence of pepsin plus food plus acid. Okay. It is a mixture of pepsin, food and acid. So the innermost part is mucosa. Okay. Assume that this is the wall of stomach. Innermost wall is mucosa or mucous membrane. Inside the mucous membrane, there is presence of lumen. Lumen contain food particles and acid and pepsin. Okay. Mixture of acid, food particles and pepsin. So here, the mucous membrane which protects these layers or this wall of the stomach from the acid. But because of breakdown in this mucous membrane, the acid will enter into this wall of the stomach and they will cause a lesions or wounds. That is called as peptic ulcer. So here peptic ulcer is nothing but peptic ulcer defined as lesions in gastric duodenal mucosa. Okay, lesions are nothing but wounds where in gastric duodenal mucosa. Okay, mucosa in the sense in mucous membrane or this mucosa innermost wall layer. So where in gastric duodenal mucosa, gastric in the sense in stomach or in duodenum. Okay, duodenum, it is the first part of small intestine. So there are three parts: duodenum, jejunum and ileum. So among these, it will cause a lesions in duodenum or either in stomach region. Types of peptic ulcer. According to definition, peptic ulcer is nothing but a lesions in gastric duodenal mucosa. Gastric duodenal mucosa. Gastric mucosa in the sense in stomach. That is called as gastric ulcer. In duodenal mucosa, that is called as duodenal mucosa or in duodenum. Gastric ulcer. Of course, gastric ulcer occurs in stomach, but which part of the stomach it will commonly occurs? In antrum. So antrum, it is a part which is present in the lower curvature. Okay, antrum, it is the part which is present in the lower curvature of the stomach where exactly it will commonly occurs. Pain on eating food. After consuming a food, huge amount of acid will produce. So because of this acid production, there will be a severe pain after consuming a food. So because of this severe pain, individual unable to control and he will expel out all the stomach contents by a vomiting. Okay. So after vomiting, there is no pain or pain relief because all the contents with acid which expelled out So because of this, there is no much amount of acid in stomach. So there is a pain relief or no pain after vomiting. Sometimes these gastric ulcer will bleed, and the blood which comes with vomit, that is called as hematemesis. Okay, so perforation is nothing but, assume that it is a wall of stomach and this is the mucosal layer. Okay, so here gastric ulcer occurs in mucosal layer. Okay, sometimes it will develop to the deep of the walls like serosa, submucosa or muscularis. So that is called as perforation. Sometimes this gastric ulcer which will leads to produce some carcinogens or cancerous cells that leads to adenocarcinoma. Okay, so this is about gastric ulcer. Next one is duodenal ulcer. Name itself saying it is occurs in duodenum. So where exactly? At the region of proximal duodenum. Proximal duodenum, which means at the starting region of duodenum. Okay, pain relief after eating a food. So after consuming a food, the pyloric sphincter will close. So because of close of pyloric sphincter, there is no entry of any material into duodenum. Okay, so because of this, duodenum is completely empty. There is nothing, like it may be a food material or it may be a acid. There is nothing in duodenum. So because of this emptiness of this duodenum will produce a huge amount of mucus. So these mucus will cover these duodenal ulcer. Okay, and it will reduce the pain. So after consuming a food, there will be a reduction in pain. So no weight loss in duodenal ulcer because there is no vomiting, so there is no weight loss. Slightly increased weight. So after consuming a food, there will be a reduction in pain. Okay, so because of this, individual loves to intake a food. Okay, he likes to intake a food. So because of this, slightly increased in bleeding. Sometimes these duodenal ulcers bleeds, and the blood which mix with feces and some enzymes which will degrade the blood of the feces and which will make the stool darker. Okay, that is called as melena. No perforations, there is no risk of adenocarcinogens. So this is about types of ulcers. Drugs which are categorized under anti-ulcer, those will classified into 4 types. Those are gastric acid secretion inhibitors, gastric acid neutralizers, those are also called as antacids, ulcer protectives, and H. pylori drugs. We'll cover all these drugs in detail with their mechanism of action, uses, and adverse effect. Thank you for watching.